shave biopsies are typically performed with a straight blade scalpel. In this case, it's a number 10 blade. However, smaller blades can be used, like a number 15 blade. Typically, this is performed for neoplastic lesions where we want to see the entire surface area of the lesion we're taking off or removing. That being said, this procedure is typically not intended to excise a lesion. In other words, we're not trying to get positive or negative margins with this procedure. We're still simply trying to characterize pathology. However, this gives us the entire surface area of a lesion to look at under a microscope. Gives us a better idea as far as the characterization of whatever we're dealing with. So in doing this procedure, we're going to clean the skin with an alcohol wipe. We are then going to anesthetize the area. And in doing anesthesia, typically what we want to do is raise a wheel directly under the lesion that we're biopsying. This does two things. Number one, gives full anesthesia to the region for the biopsy. It also elevates the lesion, which makes the shave a little easier to do. Because of that wheel, it brings the lesion up and allows the blade to undermine it. Once the anesthesia is applied, we clean the area with an iodine wipe. Now, when performing this biopsy with the straight blade, we look at the lesion we're utilizing or we're biopsying. If this is a small papular lesion, we can simply undermine the lesion, remove it, place it into the formalin. However, with large macular lesions, which are a little too big to take off in one fell swoop, we want to score the edge of the process, use our forceps to grab the edge. That way we can undermine the lesion while we're visualizing the blade. That way it ensures we don't go too deep into the dermis. One of the things that can happen with this lesion or with this process, this biopsy technique, is we can go too deep, removing the majority of the dermis, which may make healing a little bit more of a challenge or a longer process. So either procedure, we want to enter the skin at a 15-degree angle. And undermine the lesion. Once the lesion is removed, we can place it in formalin, and it's ready for submission to the laboratory. We then just clean the surface, topical antibiotic, and a bandage, and patient is ready to go.